later.
But right now we want to talk to
health.
a doctor. 3 in 5 people would ignore health symptoms, they say, because they don't want to bother the NHS.
Yes, so Dr Nigat joins us to reveal how you can recognise if you need urgent treatment or not. Good morning, Dr Nigat. Good to talk to you. Are you surprised in that, 3 in 5 people say, well, I don't want to bother the doctor?
Firstly, that statistic really saddens me as a GP because I know that that means that people are sitting on their symptoms. And in fact, yesterday I did a full clinic and I was a duty doctor, and there were a number of patients that I saw, women particularly who've got breast lumps that sat on it at home, patients who might have bleeding from their back passage who sat at home on the symptoms because they didn't want to bother the doctor. And I think that although that's great, and there's altruistic and very stoical people out there in the community. In fact, we need to be seeing you, because the earlier we can pick up those signs and symptoms, the earlier we get the investigation, the better the diagnosis will be later on down the line, and then the better the prognosis. And the whole point of general practice is preventative care, picking up things early so that we can actually get the right treatment and therefore save money, because it is an service that actually requires a lot of money to keep it going.
I totally get that and why you should be, and that is your job. But there'll be people screaming at their TVs this morning saying, I'm on the phone, I can't get a blooming appointment, I can't get a face-to-face. What are you telling me to get in touch with my doctor for when no one wants to see me or no one can see me because there's not enough staff to do it?
So the frustration is genuine, and I feel that frustration and I see that frustration. I wanted an appointment for my own son. It took me 3 weeks for a routine appointment with his own GP. There are ways to get around the system in itself. Firstly, the doctor, which is at the top of the tier, is actually not the first person sometimes you need to see. Go and see allied healthcare professionals. So speak to the pharmacist first. If you've got a foot problem that needs dealing with, have a chat with your chiropodist, and there's lots down the high street. If you've got vision stuff, go and see your optician rather than actually going and escalating that to your GP straight away. District nurses are available, the health visitor, your midwife. There's lots of individuals within the community who might be able to take you to and from hospital. So lots of surgeries will have volunteers available. There's lots of things around social prescribing that we're allowing people to use other services as well. Contact your hospital if you feel that that's a specialist thing and you need to double check with them. I'm thinking more like rheumatology or chronic patients who are under their care at the hospital. But there are lots of ways around it, and nurse practitioners at the surgery as well. So, for example, there's lots of surgeries which have nurses who are able to prescribe and look after simple things like sore throats, cuts, bruises that need looking at, burns that you might have experienced as well that just need a review and a management. And that's the thing that's happening in general practice. What's happening is that the public just feel that everything that they have needs to go straight to the GP. So we are then, as GPs, just railed because we're trying to cipher out what's happening. The expectations of general practice has to change. And I'm telling you that as an NHS GP who's been working in the system for 10 years. General practice is overwhelmed at the moment, but that does not mean that you sit on your symptoms. It means that you look at other ways, and other allied healthcare professionals who are just as fantastic at giving you accurate guidance on how to manage your symptoms.
I want to ask you, Nigat, about the self-care forum. I have never heard of this. And you're saying it's available to everybody. You're saying don't Google your symptoms. Go onto this website, selfcareforum.org. What is that website, and what help can it offer people?
So this website surprises me so much that lots of people, you're not alone, Ruth, so many of my patients that I speak to have never heard of it. Selfcareforum.org, please Google it and it goes straight there. It's a website that's set up in conjunction with the NHS, and it's literally that, self-care. There are multiple problems that you can deal with at home: sore throat, back pain, headaches, nausea and vomiting, diarrhea in children, a rash. If you are getting fever in your child as well, if you've got any aches and pains in your legs, rheumatoid arthritis, and even now they've added COVID-19 symptoms, so long COVID, how you can manage that at home. And the way that it's structured out is that it's not just like going to the NHS website where at the end it says go and see your GP. The Self-Care Forum was set up about 8-9 years ago, and it's been around that long. I just don't understand why we haven't done a lot of publicity around it. A bit like social prescribing. There is so much around social prescribing that actually patients don't know about either. And on the Self-Care Forum, it will say to you, do this stuff at home first. So, for example, a sore throat. actually it might take 2 weeks for your sore throat to get better. Do salt water gargles. Take ibuprofen if it's safe for you to do that. Do aspirin gargles. Take some pain relief. And then if you're not better, say 4 or 5 days, and you get none of these other serious symptoms, so for example, swallowing problems, breathing problems, drooling, then you don't need to speak to the doctor. But if you're getting these serious symptoms, this is when you escalate up. So I encourage everybody, all the viewers that are watching, please look at the Self-Care Forum first as your guidance of going, this is what I need to do.
Thank you,
because
Doctor.
Google is such a wonderful and weird place.
Yeah.
Because you can go down a rabbit hole. So I love social media as well. I'm on TikTok, but actually always look at verified sources.